Good afternoon, all. Good afternoon, Mr. Akil Jones. We are Group 6, and today our presentation will be based on the bacterial disease known as leptospirosis. Our group members consist of Salima Thomas, Renisa Solomon, myself, Asante Otunbo, Oriel Williams, and Tanil Torres. To begin, leptospirosis is a known disease that is caused by a bacterium known as Leptospira, which can be found in contaminated water or soil. It usually affects many different kinds of animals and people. Without treatment, leptospirosis in people can lead to kidney damage, meningitis, liver failure, trouble breathing, or even death if not treated.
A leptospirosis case is determined using both clinical and epidemiological information, such as age, occupation, location, last heavy rainfall, and the time since symptoms onset. Diagnostic methods depend on how long symptoms have been present. When it comes to methods of diagnosis, the PCR test is the most effective in the early stages, detecting leptospiral DNA within 1 to 2 days. Serological tests like the MAT and ELISA identify antibodies later in the infection. MAT is the gold standard but time consuming, while ELISA is faster and more sensitive. Darkfield microscopy allows direct visualization of the bacteria, aiding in early detection but requires skilled observation. Trends observed. Leptospirosis cases were most common among adult males aged 18 to 59. Women, children, and the elderly generally had lower infection rates except in flood-prone or low-income areas where exposure risks were higher. However, it was observed although adult males recorded the highest infection rates, the elderly experienced the greatest mortality rates, likely due to weaker immune function and comorbidities. Children, on the other hand, showed the lowest mortality rate amongst those infected. Reasons behind the trends described. Men showed higher infection rates due to greater occupational exposure to contaminated environments, while women, children, and the elderly had lower risk levels. Mortality was highest amongst the elderly because of weaker immunity and comorbidities, whereas children had the lowest mortality rates owing to stronger immune responses and fewer underlying conditions.
Good day, everyone. My name is Oriel Williams, and I will be doing the risk factor in epidemiology as it relates to leptospirosis. I will be looking at three major risk factors and their effects for this disease condition. In epidemiology, a risk factor is defined as any attribute, characteristic, or exposure that raises the probability of an individual acquiring a disease or health disorder. Risk factors may be of various types, such as genetic, behavioral, ecological, or socioeconomic, and their detection is necessary for the development of preventative and control measures. The identification of risk factors allows the public health practitioners to carry out effective interventions aimed at reducing the disease incidence and improving the public health outcomes. The first major risk factor that we'll be looking at is occupational exposure. People who are employed in places with regular interaction with animals, contaminated water, or soil, like farmers, sewage workers, veterinarians, and slaughterhouse workers, run a significantly much higher risk of getting the disease. The effects. Occupational exposure raises the probability of leptospira getting into the body through cuts, abrasion, or mucous membranes. A study states that 30 to 50% of human confirmed cases in the endemic areas are represented by workers from the agricultural sector. Rural and farming communities are particularly vulnerable to disease acquisition during the rainy season when the infection spreads more easily, and this is due to the above factor. Another risk factor is environmental and climatic conditions. Environmental and climatic conditions. Leptospirosis is a disease that thrives in this type of environment because it is warm and humid, and its spreading can be accelerated by heavy rains, flood, and lack of proper sanitation. Such conditions not only allow the bacteria that causes leptospirosis to remain viable longer, but also increases the probability of humans coming into contact with the contaminated water. The effect. When a flood occurs, It causes the contaminated water to mix with the drinking water of the people living in the affected area. Thus, there will be a sudden increase in cases of diseases. For example, in Trinidad and Tobago and other Caribbean countries, the number of cases increase after heavy rainfalls or hurricanes. Therefore, environmental risk factors are the main reason for the seasonal and geographical distribution of leptospirosis. Thirdly, socioeconomic and housing conditions. People who live under the poverty line or in crowded areas with lack of proper garbage disposal, rodent control, suffer most if they get infected by leptospirosis. Rats, the main carrier of leptospira, are very much at home in these environments, and so they further contaminate the area with infected urine. The effect: the poor people having bad housing and sanitization quality have their water and soil contaminated, and hence the disease are spread through this avenue. Research shows that the incident rate of leptospirosis is remarkably high in the urban poor settlements, leading to the conclusion that there is a connection between disease risk and social determinants of health. Hence, community interventions like rodent control, better sanitization, and health educations are important.
Primary prevention. What is primary prevention? Primary prevention refers to the intervention which is aimed at preventing the onset of the disease before it occurs. This also involves measures to reduce exposure to certain risk factors or to enhance resistance to the disease, thereby lowering the incidence of the condition in a population. Primary prevention methods. Firstly, improve sanitation and environmental management. Leptospirosis is commonly transmitted through water contaminated with urine from infected animals, particularly rodents. By improving sanitation, including proper sewage disposal, effective draining systems, and waste management, contamination of water sources can be minimized. Its effectiveness. This reduces human contact with contaminated water, significantly lowering the risk of infection and decreasing the overall incidence of disease. Secondly, public health education and awareness. Educating the population about avoiding contact with infected water, using protective clothing like boots when walking through floodwaters, and maintaining hygiene can prevent exposure to the pathogen. Its effectiveness, knowledgeable individuals are most likely to adopt safe practices while in high risk situations, such as flood or agriculture working wet areas, thereby a reduction in infection rates and mitigating the impact of outbreaks. 3. Rodent control programs. Rodents are the primary cause of carriers of Leptospira bacteria. Implementing rodent control measures such as trapping, poisoning, and eliminating breeding sites limits the reservoir of bacteria. Its effectiveness: by reducing the rodent population, the likelihood of environmental contamination with infected urine is minimized, which decreases the incidence of leptospirosis in an at risk population.
I will be discussing the secondary and tertiary preventative aspect of leptospirosis. So, firstly, in secondary prevention, in terms of epidemiology, secondary prevention aims at reducing the effects of an illness or damage that has already happened. It is accomplished by identifying and treating illnesses or injuries as soon as feasible in order to stop or limit their progression, promoting self management techniques to avoid any re injury or recurrence, and putting programs in place to restore people to their pre illness and function in order to avoid long term issues. For my secondary preventative measure for leptospirosis, we will be talking about early and proper antibiotic treatment. To continue on proper and early antibiotic therapy, let us reiterate that early detection and management is the known benefit of secondary prevention. So, the severity and length of the infection can be reduced, and the development of severe disease can be avoided by initiating antibiotic medication as soon as leptospirosis is suspected, even before findings are confirmed from diagnostic tests. Because it stops leptospirosis from progressing from mild to severe cases like Wales disease, which involves liver and kidney failure, early and adequate antibiotic therapy is very helpful in lessening its effects. Antibiotics like doxycycline or penicillin should be started preferably as soon as leptospirosis is suspected, even before laboratory confirmation. This is because early treatment can reduce the severity and length of the disease. Not only does antibiotic treatment lessen the severity and length of the disease, but it also lowers the community's leptospirosis incidence. People who receive treatment are less likely to excrete bacteria in their urine, which reduces soil and water contamination and prevents additional transmission to other people. Therefore, early and proper antibiotic therapy is an effective secondary preventative measure that reduces both the impact and the incidence by limiting the spread of the infection into the environment. Next, in tertiary prevention related to epidemiology, this focuses on the impact of an ongoing illness or injury that has lasting effects on a person. This is done by helping people manage long term, often complex health problems and injuries like chronic diseases and permanent impairment in order to improve as much as possible their ability to function, their quality of life, and their life expectancy. For my tertiary preventative measure, I will be discussing hemo and peritoneal dialysis. To continue, one of the main side effects of leptospirosis is acute kidney injury, which can lead to oliguria or anuria, or possibly chronic kidney disease. Thus, a tertiary preventative measure is to offer renal assistance such as hemodialysis or peritoneal to patients who experience severe AKI as a result of leptospirosis. This seeks to lower mortality, complications, and impairment in those who are currently afflicted by the illness. Early dialysis, beginning in leptospirosis associated AKI, dramatically lowers mortality and enhances renal recovery outcomes for patients. This intervention prevents multi organ failure, balances electrolytes, and permits the clearance of harmful waste products. Following an acute infection, rehabilitation that includes physical therapy, nutritional assistance, and ongoing renal monitoring helps patients recover more quickly and with fewer problems. Tertiary therapy successfully lower the overall illness burden by preventing chronic organ dysfunction and restoring functional capacity.
The title of the journal we chose is titled Leptospirosis Transmission, Diagnosis, and Prevention. The aim of the journal was to compare the different diagnostic methods for detecting leptospiral infection in humans, with an emphasis on early detection and suitability in resource limited and endemic areas. The findings indicated that early diagnosis is challenging due to symptoms resembling other infections like malaria and dengue. However, laboratory analysis remain essential, with a microscopic agglutination test being recognized as the gold standard. The ELISA immunoglobulin test proved useful for early detection, while the PCR methods showed high sensitivity, enabling identification of infections before antibody responses developed, further underscoring the importance for prompt diagnosis and treatment.
Two difficulties which may be faced when implementing the methods of detection and/or diagnosis of leptospirosis in Trinidad and Tobago are one, clinical overlap with other acute febrile illnesses, and limited diagnostic capacity and delayed laboratory confirmation. So, firstly, leptospirosis often presents with non-specific symptoms like fever, headache, myalgia, nausea, and sometimes jaundice that closely resemble common tropical infections like influenza and dengue. Because of this overlap, clinicians frequently diagnose more common illnesses first, leading to delayed suspicion, missed co-infections, and late treatment. Case reports from Caribbean islands show severe outcomes when leptospirosis was mistaken for dengue. In Trinidad and Tobago, particularly where dengue and other febrile illness are wider spread, this contributes to consistent under-recognition. Secondly, definitive diagnosis of leptospirosis requires specialized tests like MAT, ELISA, IgM, PCR, and culture that are not widely available in many Caribbean settings. Trinidad and Tobago often depend on regional reference laboratories, resulting in slow or unavailable results. These delays weaken surveillance, hinder timely case confirmation, and contribute to significant underreporting. Studies across the Caribbean highlight that limited lab capacity and weak surveillance systems prevent accurate assessment of the true disease burden.
For management of leptospirosis, the journal that we chose was the efficacy and safety of antibiotics
for treatment of leptospirosis is systematic review and network meta analysis. The aim: this study aims to explore how effective and safe the various antibiotics used to manage the human alignments leptospirosis are. The authors sought to address the various antibiotics used to manage suspected and confirmed cases, the signs and symptoms and recovery times associated with each, and specify the most appropriate classes for each level of severity. These analyses provide healthcare practitioners with appropriate rationales for their antibiotic choices in the management of leptospirosis. The main findings: the authors conclude that prompt antibiotic intervention improves recovery from leptospirosis. Doxycycline, penicillin, and third generation cephalosporin, especially cefixone, are the most recommended and effective treatments, leading to shorter fever, milder symptoms, and fewer complications. Severe cases require intravenous antibiotics, while mild cases can use oral antibiotics. Overall, early and appropriate antibiotic therapy is essential for effective management. We will now look at two difficulties in implementing these management methods in Trinidad and Tobago. So, firstly, is the limited rapid diagnosis and access to higher level care. Severe leptospirosis cases tend to need quick identification and supportive measures like ICU renal replacement and mechanical ventilation, as well as prompt initiation of IV antibiotics. Unfortunately, screen and treat delays and poor resource regional hospitals create gaps in the timely initiation of treatment, as poorly resourced hospitals may lack renal replacement, therapy, and/or ICU beds, which could escalate life-threatening scenarios. For these reasons, reliably applying the SMART antibiotics early rule appears to be challenging. Secondly, we have environmental/public health implementation barriers. Sustained intersectional collaboration at the community level, comprising rodent control, community sanitation, and the behavioral change to manage floods, is necessary yet difficult to achieve for long term control and prevention. Population level management is further complicated if a community is informally settled in a flood prone area, with limited access to control vectors and rodents and inadequate community disease management resources. The incidence of the disease and pressure on clinical services are expected to continue rising.
In conclusion, leptospirosis is a serious zoonotic disease common in many tropical regions. It is transmissible amongst humans through contact with the urine of infected animals, particularly brown rats. The disease is closely associated with poor sanitation and agricultural occupation. In addition, early diagnosis is difficult due to the non-specificities of its symptoms. Moreover, diagnostic methods such as the molecular and serological tests are crucial to prevent severe complications. Lastly, preventative measures, including public education, improved sanitation, and effective surveillance, are all essential to reduce transmission and control outbreaks.